Obesity is not just a cosmetic or a lifestyle issue, it is a powerful and insidious driver of cancer. Scientific evidence now clearly links excess body fat to at least 13 different types of cancer, and the mechanisms are complex, systemic, and deeply alarming. For decades, obesity was viewed primarily as a risk factor for diabetes and heart disease. But researchers have uncovered that it also creates a biological environment that allows cancer to grow, spread, and resist treatment. One of the most dangerous aspects of obesity is its disruption of hormonal balance. Fat tissue isn't just stored energy. It acts like an endocrine organ, producing hormones such as estrogen, insulin, and insulin-like growth factors in excess. This hormonal overdrive can fuel the growth of hormone-sensitive tumors, particularly in breast and uterine tissue. Postmenopausal women with high body fat, for example, are at significantly greater risk for estrogen receptor-positive breast cancer, a form that is often more aggressive and more likely to recur. Chronic inflammation is another key factor. Obesity triggers a persistent, low-grade inflammatory response throughout the body. This inflammation damages cells and DNA, weakens immune surveillance, and promotes the creation of an environment in which cancerous mutations can occur and thrive. Over time, the body's ability to detect and destroy these malignant cells is compromised, and tumors are more likely to take hold. The digestive system is especially vulnerable. Obesity increases the risk of colorectal cancer by promoting insulin resistance and inflammation in the gut. Excess fat also alters the gut microbiome in ways that can stimulate carcinogenesis. Similarly, obesity is a major risk factor for liver cancer, not only through fatty liver disease but also by accelerating cirrhosis and liver inflammation, which set the stage for malignancy. Pancreatic cancer, one of the most lethal and least treatable cancers, is also linked to obesity. Elevated insulin levels caused by excess fat can overstimulate pancreatic cells, increasing the chances of mutations and tumor formation. With obesity, the pancreas must work harder and under more metabolic stress, conditions that promote cellular damage and cancer progression. Other cancers associated with obesity include kidney, gallbladder, esophageal, ovarian, thyroid, multiple myeloma, and meningioma. Many of these are difficult to detect early and have poorer survival outcomes. The connections often stem from the same culprits: hormone disruption, metabolic dysfunction, and inflammation. What makes this all the more dangerous is that obesity-related cancers often appear in more advanced stages and respond less favorably to treatment. Fat deposits around organs can limit the effectiveness of radiation, make surgeries more complicated, and interfere with chemotherapy dosing. In essence, obesity doesn't just increase the risk of getting cancer, it makes nearly every aspect of cancer harder to survive. There is also the disturbing reality that these risks begin early in life. Childhood obesity can set the stage for adult cancers, with metabolic changes and hormonal imbalances beginning far before symptoms ever appear. And as obesity rates climb among younger populations, we may be heading toward a future where cancers once seen primarily in older adults will become more common in younger age groups, with devastating social and economic consequences. The warning is unmistakable. Obesity alters the body in fundamental ways that make cancer more likely, more severe, and more difficult to treat. And yet, public health messaging has failed to reflect the gravity of this link. Addressing obesity isn't just about weight loss, it's about cancer prevention. Without urgent, widespread efforts to combat this epidemic, the burden of cancer will continue to grow, faster, deadlier, and in more people than ever before.